Hello, my name is Jacqueline Vonglis, and I am working with my partner Dana Morris. We are senior SRNAs in Drexel University's Nurse Anesthesia program. For our Doctorate of Nursing Practice project, we are providing education on Sugamidex and Amend education practices. Keep this presentation brief but be comprehensive. We will start by introducing our DNP project, which we are implementing at Capital Health, the goals of our project, and new workflow, the pharmacology of Sugamidex and Amend, and its effect on our patients, and then finally we will end by discussing the education which will be provided to at-risk patients. At Capital Health Medical Center, there's currently a gap in patient education. Specifically, patients of childbearing age who use hormonal contraception and receive either Sugamidex or Amend are not consistently being informed about how these medications can interfere with their hormonal birth control. This represents a breakdown in communication and patient safety. These patients may not realize that their contraceptive could be less effective after receiving these medications. As a provider, we have an ethical duty to protect and support patient well-being. When we fail to educate patients about how a medication may affect their contraception, we are violating our professional responsibility to provide complete and accurate information. This isn't just a matter of policy, it's a matter of ethics and trust. Patients rely on us to give them the information they need to make informed decisions about their care. This slide outlines the main goals of our quality improvement project, both focused on improving knowledge and consistency in patient education. Our project consists of a two-part intervention, so the first part addresses provider knowledge gaps. One of our first priorities is to ensure that both PACU nurses and anesthesia providers are aware of the implications of medications like Sugamidex and Amend, especially regarding their effects on oral contraceptive efficacy. We identified through surveys and observation that provider understanding of these interactions and discharge counseling responsibilities was inconsistent. To close this gap, we created this educational presentation, which will be provided to all PACU nurses and anesthesia providers. We will also be meeting in person during the November anesthesia meeting and on the day of implementation with PACU nurses. The second part of our intervention focuses on addressing the absence of a standardized educational protocol. Currently, there is no standardized process or educational material for counseling women who receive these medications. To improve consistency, we're introducing bright-colored educational sheets. These will serve as a visual cue and help ensure all patients receive clear, standardized instructions before discharge. This approach aims to make education more visible, reliable, and memorable for both patients and staff. Our overall goal is to increase the number of patients who receive high-quality, standardized education on medication interactions, improving the patient safety, satisfaction, and continuity of care. This slide explains the new workflow for both anesthesia providers and PACU nurses to ensure consistent patient education for women receiving Sugamidex or Amend. Anesthesia's responsibility in this process includes during patient handoff to PACU, anesthesia providers should first determine the answer on two key questions, the first of which being, did the patient receive Sugamidex or Amend? And the second being, is the patient a female aged 15 to 50? If the answer is yes to both, the anesthesia provider should insert the appropriate brightly colored educational sheet into the patient's chart before dropping the patient off in PACU. This serves as a visible cue that signals to Phase 2 PACU nurses that this patient requires specific education regarding medication and contraceptive interactions. PACU's responsibility includes being before discharge, checking the patient's chart for the bright colored educational sheet, and if that sheet is present, providing education to the patient regarding medication effects and contraceptive precautions, including the sheet in discharge paperwork for patient reference, and placing the top copy in a designated collection bin at the nurse's station for tracking and quality monitoring. This standardized process will ensure that all eligible patients receive consistent, proper education, closing the gap between medication administration and discharge instructions.
Amend is a neurokinin-1 receptor antagonist used to prevent postoperative nausea and vomiting. It's especially effective in patients at high risk for PONV, which often includes women of childbearing age. Though this medication works great for PONV, it does interact with hormonal contraceptives. Amend can bind to ethinyl estradiol and norethindrone, which lowers the circulating hormone levels and reduces contraceptive effectiveness. So even after just one dose, patients should be advised to use backup birth control method for up to 28 days. Sagamedex is a commonly used agent to reverse neuromuscular blockade. It works by encapsulating and inactivating paralytic agents like rocuronium. But similar to Amend, there's an important consideration for women of childbearing age. Sagamedex can also bind to progestogens, which are found in hormonal contraceptives, and this can lower the circulating hormone levels. So even though we're just giving a single IV dose, it may reduce contraceptive efficacy for up to 7 days. So women should be advised to use a backup birth control method for at least 1 week after receiving Sagamedex. In order to properly inform our patients, we need to know which contraceptive methods are actually affected by these drugs. So on the left-hand side, we have the methods that may become less effective after receiving Sagamedex or Amend. These include birth control pills, Depo-Provera, the NuvaRing, hormonal IUDs like Mirena, and contraceptive patches. Essentially anything that relies on hormones to be effective. So on the right-hand side, we have some safe alternatives that we can recommend. These include abstinence, male or female condoms, copper IUD like the Paragard, as well as diaphragms and spermicide. So any form of contraceptive that does not rely on hormones to be effective. We can suggest these safe alternatives for that window of decreased efficacy. So to summarize the key education points, we're targeting women of childbearing age, roughly 15 to 50 years old, who have received either Sagamedex or Amend in the peri-op period. Once we've identified those patients, we need to make sure that they're aware that their usual hormonal birth control method may be less effective and that they should use a backup method. Safe alternatives include abstinence, male or female condoms, copper IUD like Paragard, diaphragm or spermicide, basically anything that is non-hormonal. And lastly, the patients need to know for how long they should be using this backup method. So if they've received Sagamedex, they need a backup contraceptive for at least 7 days. And if they've received Amend, the window is larger. It can last up to 28 days. So here we have a quick summary of the new workflow. So the patient arrives for surgery. If they do not receive Sagamedex or Amend in the peri-op period, they will just continue on to phase 1 and phase 2 PACU like normal. However, if they did receive it and they are a female patient aged roughly 15 to 50, when that patient gets transferred to phase 1 PACU, the anesthesia provider will take one of the educational handouts, which we'll have located around in PACU, and place it in the patient's chart. This will then follow the patient into phase 2 PACU. So when they get there, the nurse can open up the patient's chart and then we'll see that the educational handout is there. And they will use that to educate the patients, and they'll take the top page of that packet and place it in either the Sagamedex or Amend bin that we'll have in the phase 2 PACU, and then the rest of that packet can go with the patient. Thank you for watching our presentation and participating in our DNP project. We really appreciate it. If you have any questions, concerns, suggestions, please feel free to reach out to either me or Jackie.